Joe Robertson, welcome to the Isle of Wight County Press. You're standing in the Isle of Wight East constituency for the Isle of Wight Conservative Party. So for the first round of questions, we've been asking County Press readers, members of the public, to write in. The first topic, of course, is one that's a pertinent one, ferries, and the fact that they've been overpriced and unreliable for many years now. Nick wants to know exactly what you would do to improve cross-solent travel.
Yes, so I've seen how not only are the ferries not good enough, they've got worse in the last 20 plus years. They're worse now than they were when I was growing up. So for me, it's got to be a realistic solution. And I think the best realistic solution is regulation by government. I think the ferry companies will make some improvements around the edges, but they're clearly not going to make the scale of improvements we need without government stepping in. So I want to work with 2 MPs on the island, with 39 councillors, with all residents, to make the case to whichever government comes in on July the 4th to step in and regulate the ferries. And that means regulation on prices, and it means regulation on timetable.
Okay, and going back to that, I mean, the Conservatives have been in power since 2010. Why has that not happened already?
So as I say, I think the ferries have got worse, so I think the case becomes ever more compelling for government to step in. It's a major step for government to step in on effectively private businesses. The Conservatives have put it in their manifesto just 2 days ago that we want to see a all options review into cross-solent travel. And it's in that review I will take the opportunity with the other MP, with 39 councillors, with residents, to say the outcome of that review should be government now needs to step in and regulate prices and regulate timetables. I think the case is more compelling now than it ever has been, and that's why the next government, whichever government comes in, needs to deal with it. But it needs us to come together, put party political differences aside, and work together with whoever's in power at number 10. And
then moving on to dentistry, then obviously Islanders for many years have struggled with appointments. Even registering to get a dentist is hard these days, even for young people, old people, depending, it doesn't matter on your age, it's just a bit of a struggle. And Mike wants to know what you would do about that and how you would improve that.
Yes, so I think there's a problem with dentistry both at a national level and at a local level. So nationally, the NHS contract for dentistry dates to 2006, brought in by the previous Labour government. It wasn't particularly well thought out at the time. It's now very out of date. So again, the next government needs to reform NHS dentistry. But on the island, we haven't done well with the money we've got. So the Integrated Care Board, who awards contracts to individual dental practices, have managed to underspend £3 million on the island last year. That's £3 million made available through the NHS by government that we didn't spend on the island. And that's because they issued inflexible contracts. So they awarded contracts to some providers who didn't manage to deliver all those appointments, but they also delivered to a provider not enough places, not enough dental appointments, and they could have provided more.
And going on to storm overflows, sewage discharges off the island, we know that's been a big problem as well. I think last year there was over 5,000 hours worth of discharges in Cowes alone. Michael wants to know how you would hold Southern Water to account and what you would do to stop sewage pollution in rivers, estuaries, and of course on the seafronts.
Yes, so Southern Water have not got a good record on this. We know that. They've received a huge fine for sewage discharges elsewhere. Now they're starting to make changes and they have money to do it. On the island, we've seen they've been rolling out free slow release water butts, and that's to stop the storm discharge. So we know that it's when rain comes, it's rainwater that enters the combined system and causes the sewage spills. If our system only had sewage alone, it would be okay. So it's about capturing water. I'm concerned that Southern Water are taking a very long time to roll out quite a simple scheme, and that concerns me. If the Isle of Wight Council can roll out free wheelie bins within weeks, months, why are we into year 2 of Southern Water rolling out their water butts? So I think Southern Water need pressure, and need pressure from 2 MPs and councillors and residents.
And moving on to energy bills, we know that they're £400 higher than they were, say, 3 years ago, despite the price cap coming down next month in July. So what would you do to support islanders who are struggling with the cost of living crisis?
Yes, so the best support for everyone, but particularly those who are struggling, is to tackle inflation. It's the inflation that obviously drove cost of living crisis and energy bills. So it's about a stable economy and low inflation. Obviously inflation has come right down again and it needs to stay low. we can't take it for granted that just because inflation's come back down to near the 2% mark, that it won't go back up again. So I think on that, we're genuinely talking about national economic environment, and the next government needs to ensure that the economy powers up again, inflation remains low. And that's the best way of controlling energy prices. But if they do start to go back up to the worst levels we saw, you need that cap, and people need support, and I'll be championing islanders who need financial support.
Yeah, okay, and moving on to education, the outcomes and support for schools on the island. How would you go about improving that?
Yes, so the biggest problem we have in education, particularly at primary level, where we have an oversupply of school places, because the birth rate's fallen on the island, and that means we've got several hundred extra places in our schools that are unfilled. And because education funding is done per pupil, it means we've got schools that could take more pupils. They have the staff, they have the building, they have the facilities, but there aren't children to go into that school, and therefore they have reduced level of funding because the funding is done by actual pupils on seats rather than places available. So the council has got a huge issue facing it, and schools will have to be consolidated. Some schools will have to be closed. But what I will do is make sure that any proposal for school closures is done in full consultation with parents, residents, and there's evidence-based.
Yeah. Okay. Moving on to NHS and the hospital in particular, St Mary's. We know it struggles with the availability of beds, the pressures that come with winter and the summer months, and of course the mainland factor as well. How would you support the island's hospital in particular?
So I think again the problem we have with funding through NHS and social care. Well, first of all, there are two funding streams: NHS to government, social care through the council. Yet the two are interlinked in terms of pressures. I don't think there's enough money directed into community care. So at any one time, a quarter of beds at St Mary's are occupied by people who have no medical reason to be in those beds, but they can't return home because there isn't the support there. I think we need a whole change in the way we see funding around NHS and social care, and more of it needs to be spent in the community. So I work for a charity that increases the amount of community-based nurses up and down the country to help people at home. So that's my professional background. I want us to view care in the community as a much bigger thing, not only in a hospital, and that helps the hospital. Yeah, and talking about a community, GP surgeries more locally, how would you support them? Because we know islanders, again, struggling to get appointments, aren't they? Yes, they are, and GP practices, by the way, are a great place for care to be delivered. So if not in your own home, then GP practices are much closer to most people's home than one central hospital is. So GPs are now employing nurses and employing other health workers, which I think is a good thing. I think people need to get their head around, including me, the idea that you might go to see your GP or your GP practice. It's not necessarily a doctor who you visit, but depending on what your needs are, a nurse might be a better person to see than a doctor. It depends on what your need, what the demand is. But I think GP practices are probably understandably having to adjust to a new way of working, and that's putting pressure on callers and waiting lists, etc. And crime then, moving on to crime, we know that ASB's stop and search, dispersal orders, bobbies on the beat, crime levels are all key policing concerns here on the island. Working alongside PCC, obviously Donna Jones, how would you set and achieve goals in those areas? Yes, so I work very well with Donna Jones. I've known her for some time, and in fact got her over to the island just a week ago to come and talk to local businesses. I think she's a great police and crime commissioner, and she needs to work well with two MPs. So two campaigns that we're working on at the moment. One is to reduce stop abuse to retail workers. We're beginning to see a rise in that, where people walk in, steal things from particularly supermarkets and walk out as though the law doesn't apply to them, and that cannot be allowed to continue. And there's certainly a sense that the police don't respond as they should. So in Sandown, we're looking to set up a new shop watch that used to exist to help businesses engage. And businesses, it's not only antisocial behaviour or crime that happens in businesses. Businesses are usually very well placed to know their communities and help. I have to cut you off there, but moving on to the next round of questions. Yes or no, would you nationalise trains? No. Would you push to rejoin the EU? No. Island or party first? Island first.
National service, yes or no?
Yes.
Energy, nuclear or alternative?
Mixture of energy, so
Okay.
including nuclear.
And should 16-year-olds be allowed to vote?
No.
Conservative has had 7 years locally, 14 years in government, and there's been 5 prime ministers in that time. You know, you say all of these policies and what you would do, but you know, Conservatives haven't done it already in the time that they've had. So if they're not going to do it now, when will they?
Yeah, so I think most people would agree it's been a very challenging time over the last 6, 7, 8 years, and I don't find it hard to say the government haven't always got it right. I'm prepared to accept that. I think when people go to vote this time, they've got a vote for who goes into number 10, and they've got a vote for who is their MP, and they might find that they want 2 different outcomes from that. People might feel that whoever goes into number 10, they still want the best person to represent them here, and I'm putting myself forward. Yeah, of course I'm a Conservative, of course I want a Conservative government, but I believe I'm the best local choice to be the next MP, regardless of party. So that's the case I would be making to people, and I don't mind holding the feet to fire of either government, and I'll work with Labour if it's Labour, and of course I'll work with Conservative if it's Conservative.
Okay. And we noticed, obviously, part of your campaigning, you've hosted Suella Braverman to the island back in February, I believe, in Ryde. She's infamously said in the past that homeless tents are a lifestyle choice. I mean, are you comfortable being associated with those kind of views?
So I don't agree with some of the things Sewella has said. I don't agree with things that some politicians say within my party. I don't find that unusual. It'd be very strange if 300, 400 people all agreed with everything everyone said. So but I'm not going to shy away from raising the profile for the island by bringing a national politician here. And I'm not going to step away from the fact that Suella Braverman also has a following, and she got a seemingly good reception in Ryde. So no, I don't agree with everything she says, but that doesn't mean that I'm going to not work with or ignore people who I don't always agree with.
Okay, and as MP, if you were to be elected, what would your first top 3 priorities be straight into the job?
Yeah, so top 3 priorities would be promoting business and jobs. I think the island MP should be the island's greatest ambassador for bringing in investment, new business. I would also be wanting to improve community healthcare from day one, and look to influence at all levels, government, but also working with local groups down here as well, and using my expertise and knowledge working in that area, and also continuing the support for local schools. And I think that is something that's going to come right on our horizon for September, October, when the council are going to be consulting over potential school closures. I want to be right there representing communities, parents, groups, to make sure that any decision the council makes is well thought out and properly consulted on.
Okay, and if you do get into office and the other MP, of course, in the West constituency isn't Conservative, and could be Labour, could be Independent, could be whatever, how would you work with them? Yeah,
so I want Bob Seeley to get elected. I wanted to be a Conservative, and I think that would be the best for the island, Joe and Bob working together. If it's not, if I'm working with someone else, I have no concerns that I would be able to do that. I think, as you'll probably know, Ollie, when the cameras are off, politicians tend to get on better than people might think they do, and I have no doubt that I'd be able to work for the good of the island with an MP of a different political party. I think everyone who's standing in this election on both sides wants the best for the island. I have no concerns about that. It's about how we do it. But as I say, the best option, I think, would be for me to be working with Bob Seeley, but I'll work with whoever the West Wight decide.
Okay, and very finally then, why should islanders put their trust in you to be their next MP?
They should put their trust in me because I'm an islander too. I grew up here, I work here, my children are here, they're growing up here too. So my priorities are island priorities. They're indivisible, just like for all of us who live here. I've got the experience. I've worked. I was formerly a solicitor. I now work for a healthcare charity. I'm still a sitting councillor on the island. I've got a track record of actually wanting to make a difference to people's lives, and I believe I've got the energy, determination, passion to be doing this in just 3 weeks' time.